and welcome. My name is Danielle Hallstrom, and I head Commercial Communications and Patient Advocacy at Bristol Myers Squibb. I'm so glad you could be here today. Thank you for making the time to attend. First, I want to take a moment to recognize that we are living in an unprecedented time. I sincerely hope that you and your loved ones are safe, healthy, and well. For better or for worse, the current situation is what drove the creation of the COVID Advocacy Exchange, the focus of today's session. Launched in May by Bristol Myers Squibb in partnership with Grit Health, the Exchange is a unique and innovative way to support patients and patient advocates during these uncertain times. Much like the global virtual cancer conference that unites us around empowerment, the COVID Advocacy Exchange is a virtual platform that brings together people from around the world to synchronize efforts, to share information, and to exchange in discussions about key issues faced by people with chronic and other diseases. To date, more than 15,000 people from more than 80 countries have visited the Exchange, participating in live discussion sessions, and more than 50 patient advocacy groups have created virtual booths to share free resources. Today, you'll hear from three of these people: a patient, a caregiver, and an advocate, who will speak about the challenges that people with cancer face, and how through connection and collaboration, we have started to overcome some of these pandemic-specific problems together. If after today's session, you're interested in participating in the COVID Advocacy Exchange, I encourage you to register for free at www.covidadvocacyexchange.com. Now I'd like to introduce my amazing colleague and friend, Cathy Traz. She's the Executive Director of the Global Advocacy Group at Bristol Myers Squibb, and she will be moderating today's session and introducing our panelists. Thank you again for your time and your commitment, and I hope you enjoy today's event.
Everyone is having to embrace new approaches to the way that we live our lives, embrace new ways that we support the patient communities that we represent.
We have all of the, daily emotions and thoughts that go through our own brains, and then those of the ones we love, and then you have our maybe our neighbors, and then you have our communities, and now we're as a state, and then as a nation, and then as a world.
This effort to provide tools that we can collaborate and we can find common ground and common ways, I think is really critical.
You go a long way if you collaborate, you allow everyone to have their opinion and then bring it together with a solution.
Listen to the advocates, listen to the voices. Let's combine our resources so that we can be even more productive from a regulation perspective, from patient perspective, from the treating physician perspective, and the industry perspective will give us more strength.
The challenges and the journeys that we as patients and that our communities face do not pause. This is why I am honored and humbled to have this time together and for co-creating this advocacy exchange together. We hear your passion and we understand the challenges. We are going to tackle them together.
Hello there, everybody. Thank you so much for joining as people start to come in. We're so excited. Hi there, and my name is Cathy Traz. I'm the Executive Director of Global Advocacy at Bristol Myers Squibb, and I am delighted to be here today to moderate today's session about the COVID Advocacy Exchange. So this is a resource that has been near and dear to my heart since it was launched this spring. The Exchange, if you don't know, the COVID Advocacy Exchange is an online platform that was developed in response to COVID-19 to help patients and advocates really connect with one another. So through the platform, participants, kind of like, like this global virtual conference, you can attend live sessions, access previously recorded discussions, or even visit the exhibitor area to learn more about many, many different patient groups. There are more than 50 of these booths, 50 different organizations, and more than 15,000 people from around the world have visited the COVID Advocacy Exchange. So today we are lucky enough to have 4 of these people with us to share their firsthand experiences of participating in the COVID Advocacy Exchange and how they've used it to connect with others during this really unprecedented time. So with that, I'm going to introduce our 4 panelists. So first we have Michael Wrigglesworth. He's Senior Director of Programs, Strategy, and Data Solutions at the Max Foundation. For those unfamiliar with the Max Foundation, it's a nonprofit global health organization that channels humanitarian donations of life-saving oncology products to underserved populations in countries where those products are not available locally. The foundation's CEO, Pat Gonzalez, participated in our coalitions and collaboration session on the exchange in May, and they have a booth in our virtual hall on the COVID Advocacy Exchange. In his role at the Max Foundation, Michael is responsible for programming to help the organization achieve its goals. So welcome, Michael. We also have Kawaldip Sehmi with us. Kawaldip is the CEO of the International Alliance of Patient Organizations, also known as IAPO. The organization's mission is to help build patient-centered healthcare worldwide. Really excited to have Kawaldip here today as well, since IAPO also has a booth in the COVID Advocacy Exchange exhibit hall. So in his role at the organization, Kawaldip oversees its strategy and direction. He has extensive public health experience. He, at both the national and international levels, previously serving as the CEO at Richmond Psychosocial Foundation International, and also working as managing director of Quorum Children's Legal Center. He has European and international public health experience as director of global health inequalities programs and is chairman of the European network of Quitlines. So Kawaldip has a Master's of Science in Public Health from the London School of Hygiene and Tropical Medicine, an MBA in Business Administration from the London Business School and Open University, and a Bachelor of Law from the London College of Law. So welcome, Kawaldip. We're very happy to have you as well. We also have Dave Fuhrer. If you haven't seen him yet during this Global Virtual Cancer Congress, I'm surprised because he's been all over the place. But Dave is the CEO of Grit Health and our partner, an incredible partner as we've worked together to launch the COVID Advocacy Exchange. Dave is a 2-time cancer survivor, a caregiver, a passionate advocate, and really, as I said, an amazing partner. And then last but certainly not least, my colleague, Jen McKee. Jen's an immuno-oncology product specialist at Bristol Myers Squibb, close to my heart. Jen's been at BMS for nearly 7 years, and prior to her role here, she worked as an oncology sales specialist at Novartis. Jen holds a bachelor's degree from the University of North Carolina, Charlotte, and an MBA in marketing from Loyola University. So importantly for today's discussion, Jen's also a breast cancer survivor. So she'll be speaking from her perspective as a patient. So once again, thank you all for joining us this afternoon, and let's get into it. I think I'll start with Michael and Kawaldip, if that's okay, since you both are here for your organizations. Can you tell us a little bit about the kind of information that your organizations have available in your exhibit halls on the COVID Advocacy Exchange, and really why you decided to put up a booth? So maybe, Michael, maybe we'll start with you.
Sure, thanks for asking. Yeah, I think we view this as just a really great opportunity to tell our story and to amplify the voice of our patients. I think that cancer is such a ubiquitous problem. Whenever we're given the opportunity to speak with people, there's an instant connection that can be made, because I think we all have some kind of story about cancer and how it's affected our life, either directly or through our loved ones. So by having the opportunity to, I think, focus on our patients that are in low and middle income countries, you can take that connection and kind of layer on some really interesting caveats that I think a lot of people don't think about when they think about a cancer diagnosis. There is unique challenges in the countries where we work. And I think hearing that story directly from the patients. So if you look at the booth and you read some of those stories, you really get an understanding of kind of what the challenges can be in the countries that we work in. And so I think that was just a really great opportunity for us to amplify their voice.
Yeah, thank you, Michael. I think that's a really, really good point. And Kawaldip, what made IAPO join, put up a booth, and what kind of information are you sharing there?
Yes, I think the first thing was that we were really appreciative of the fact that there was an attempt to hold a virtual, what I would say, platform, or where we could all meet. I think at the time when we were really trying to look at face-to-face conferences, and when they went out of the window because of the COVID, there was nowhere we could talk, and I'm very thankful for the COVID advocacy exchange to be put up so quickly, because it was something that almost filled the gap, and I think we could come and talk and share our angst and share our experience. But having firstly put up the booth there with all of our links to our activities, and I'll share with you another link a short while, which isn't on that booth at the moment, but we should have put up. We liked it so much. We actually went ahead and spoke to Dave and COVID Advocacy to help us. And we actually hosted our Global Patients Congress on the same. I not only bought the booth, I also bought the whole conferencing platform for our Congress. So I think, thank you very much, Cathy and Dave. I think it was such a lovely platform. I think this was needed. It was so critical. And I think being the first, it has almost set a trend for the future. I think it's almost setting the norm. And I'm so glad that you guys have done what you have done, because it sets a standard, if I can say so. I think it sets the standards. I have been on terrible events, and I've always said to them, please join the COVID advocacy work. In fact, go and see how that's done. And they've all thanked me for that. They come back with, that's how they'll do things better. So that's why we're here. Plus, as a cancer patient myself, I thought it's good to talk to other patients. I wear a colostomy bag, and I think I've seen several of you from the ostomy advocacy, bladder cancer, and others here, and it's good to share that people like ourselves. I think it's really about my family, and that's my family here. So it's good to talk to you. Thank you.
Well, thank you so much. First of all, for the very ringing endorsement of the Advocacy Exchange and how it's helped, but then how also IAPO has used that platform to reach out to their membership and to their patients. So thank you so much for that. Jen, let me ask you, as a cancer survivor, what do you find most valuable about the COVID Advocacy Exchange?
Thank you, Cathy. I feel that the exchange is just another example of not only Bristol Myers Squibb's, but Grit Health's commitment to improving the lives of patients. As a sales rep working from home during this time of COVID, and also being a patient, I felt extremely far removed from people, my connections, my extended family, etc. And this platform has enabled me as a patient to still feel connected by attending the live weekly sessions and just hearing about other patients' paths and experiences. I also find the Breast Advocate app that I found on the virtual exhibitor hall as a very valuable tool. Had I had this when I was first diagnosed, I think it would have really helped me to frame the conversation, the initial conversation that I was going to have with my surgeon, and to make decisions collectively with him and also the rest of my medical team. I found it to be very, very helpful. And I think it would have empowered me as a patient had I had it. But now in the survivorship phase, I will certainly utilize that tool going forward. But I just want to thank all of those involved for creating this platform for patients like me to be able to connect with others, especially at this challenging time.
Jen, thank you so much. And I honestly, I agree wholeheartedly with you about the need for connection with those who are like us or feeling these things. And, you know, this to me goes across. So it's not just the advocates now or the patients that have been involved, but, you know, us in industry, our partners at Grit who are doing a lot of the tech work behind it. I mean, it's a really a nice place to have to go, you know, during this COVID time where you don't always know where to go or who to talk to. And so we really appreciate you being there and joining us there.
I'm humbled. Thank you.
Thank you. So Dave, I was just kind of mentioning Grit Health. So tell us why you were so enthusiastic when we reached out to you about partnering in March to say, hey, you know, do you think we might be able to do something like this to help people? And then also, what kind of feedback have you gotten from advocates or people participating in the advocacy exchange?
So the honest answer to why I was all in so quickly is fear. And I've learned from myself over the years that when things feel out of control, the way I try to cope with it is to take action and feel like I'm a part of doing something. It's as much out of needing to feel not how out of control things are. And when COVID started, it affected not just one area of our lives, but so many areas for everybody around the world. And my immediate need to be a part of support was really born out of fear, how it would affect all of us. And what I've found, I'm so glad that we're all doing this panel now, whatever it is, 8 or so months later since we've started all this. What I've found is that by coming together, by bringing advocates and people together from around the world and from many different disease areas and different life experiences and talking about how we're all affected differently, I have a new understanding of something that is so much bigger than the way I ever looked at something. And so it's been a humbling personal transformation for me, Cathy, just as much as it's been, you know, creating something global to support the Advocate Network.
Dave, I love that. When you first said that you responded out of fear, I thought you were going to say you were afraid of me, but I'm glad that you, I'm glad it was a mutual fear of COVID and the, you know, isolation. But it is true. It is scary. It's very scary times for everybody right now. So thank you for that honest feedback and response. I guess to all of you guys. Oh, go ahead.
May I stay with that just one more second, Cathy?
Yeah.
The other part that you asked was, you know, what have we heard from people? And things that I never expected. So, you know, connecting people to resources can be life-changing. And Jen, the story you shared about learning about the the Breast Advocate app, we've heard so many of those from people around the world learning about things that they wouldn't have. And those are the purpose for why we all jump to action. The really unexpected things are the way people have shared that they're talking about things they never talked about before. And Cathy, we've shared that so many people have sent private emails and said, I feel like I have a place where it's safe to talk about things I didn't think I could talk about before. And so much of our sessions, people have been able to connect and exchange around things that they were kept hidden. And during a time of pandemic, the only way to solve problems is to be open about them. And us being open has been the most surprising and most incredible feedback we've gotten.
Yeah, I mean, I agree. I don't know. You know, we've heard from several of the advocates as well, from BMS being, you know, a sponsor, about how really important this is, and just again to have that place to go and to connect. And it's 24 hours a day, you know, 7 days a week that you can go on. So yeah, I think it's been very important. So let me ask all, I guess I'm going to ask all of you, I'll kind of move to each, but one of the most well-attended sessions focused on coalitions and collaboration. So kind of on this path of, you know, coming together. So all of you collaborate, you know, with others in some way, whether it be through the jobs or with your family members or friends. So in this odd time of living together, do you have any tips for working together across the disease areas? Because this is another difference, I really think, that we're seeing folks work across the disease areas, across geographies, and even with other stakeholders in healthcare, in order to create, you know, a greater collective impact. So what would you, you know, what kind of tips would you give to work across the diseases and with those other advocates? And maybe I can start this one with Kawaldip.
Thank you very much, Cathy. I think this is a discussion we were just having about 8 hours ago here in London. And what we said was that the first thing that we learned to do, that we started trusting each other. I think there was sharp rivalry between patient groups and that. And we always accused the health system of having worked in silos and you know, in a defragmented way, in a fragmented way. We realized that we too had been guilty of the same sins, you know, that we have been working in a fragmented way across the health systems. So what we have said is, let's build the trust in collaborating with each other. Let's work collectively. Let's come out of our silos. Let's integrate that work together. And we are going behind the slogan of build back better. I think to build back better, we'll need to all work together and fix up the common parts of the health system that we need. And what has COVID shown us is that previously, whilst, you know, the people with blood issues, blood transfusions, say thalassemia patients, they only concentrated narrowly onto their topic. And you know what, they didn't want to hear me or hear the cancer patients, or they want to hear the diabetic patients, and they're only concerned about their particular transfusion services, and that's all. And when this thing came, it felt like dominoes, you know, and suddenly they realized they needed us and we needed them. We couldn't ignore each other. So we've come back together and seen the health system for what it is. It's one holistic organism. And if one gets hurt, everybody gets hurt. And therefore we need to go work collaboratively, drop our sort of isolationist way of working. Let's look at building trust and building back better. So that's what we have learned in that it needs collective working.
Yeah, Kawaldip, I agree. Thank you so much for that. I mean, across sector, across geographies, absolutely. Michael, let me ask you kind of that same question, because you guys are also working, you know, across the globe, but especially, you know, in areas where they don't have the access as do some other countries. So what would you, what would you say about working together during this time? What maybe tips would you have from the Max Foundation for all of us?
Yeah, thanks for pointing that out, because I think that collaboration has really been central to our model for years. When you're trying to get medicine into various countries, as you can imagine, the logistics are tricky. We need to partner with governments. We partner with pharma. We partner with patient groups. And I think that if anything, something like a global pandemic can show us is that there's much more that we have in common here than we want to admit sometimes. And I think there's a lot of opportunity there for cross-field coalitions. We are experiencing the same problems, no matter if it's what disease it is. If you can't get medicine into a country because of shippings and customs challenges due to COVID, if there's lockdowns where patients can't go to their clinic and be treated by specialists and whatnot, anybody with a chronic disease is facing that challenge right now. So there is just a lot of opportunity to, I think, kind of recognize that we're all fighting, and we're all fighting these cross-current cultural challenges with lockdowns, with economic hardships, with psychological hardships. And I think just kind of focusing on those commonalities is really going to be helpful to us. We have seen major input from our pharma partners, kind of in a really, giving and generous way, to make special circumstances available for patients that are stranded somewhere or can't get to where they normally get their medication. We've seen our patient groups volunteering to bring medicine to people. We've seen police and firemen that are the only people that are allowed to be on the street sometimes during a lockdown to deliver medicine to patients. And at the same time, we've also had, I think, a big push for everybody to innovate quickly, where things like e-prescriptions and so getting pharmacy chains to work with doctors, to work with governments, to relax some sort of regulation on quickly. It's really shown me how quickly we can make a change happen when we really need it and when that pressure is really on. And those are problems that are not unique to any one disease. And I think that piece is really kind of the focus of, we all acknowledge that these times are challenging and whatnot, but also just, I think, a great opportunity there to say, if we could do this the way that we wanted to, what would that look like? And that, collaborations and working with people that we really look up to, that are members of this and other coalitions, I think is where we really start to find those solutions. And then I think just the idea that people need to keep telling their experience, because the more we talk about it, the more you will find those commonalities. And I think that's really a key message. And I am a IT background, so I'm sort of a data obsessed. So we also like to keep data, quantify your problem. You will find that I think that there is many people facing that challenge, and when you have numbers behind you, you can really come through with, I think, some unique solutions that will be not just COVID solutions, but will be something that lasts in a continuing way when we get to the other side of this this one problem, right?
Yeah. I mean, I love that, kind of innovation across sectors. And it's people are expecting that now, right? They're really expecting this innovation to come. Jen, I wonder from you, Michael touched on the fact that, pharma has kind of stepped up and been collaborative and supportive, but, what are you seeing, in your work and in your life, and, what do you think would be some kind of tips for working across?
Sure, Kathy. So, as a sales representative for Bristol Myers Squibb, utilizing these virtual platforms has never, or to this extent, has never been anything that we have ventured into before. And now being forced to do that, it's shown us that it can be a very effective way to communicate with others. I would love to echo what Michael and Kawaldip were saying in terms of collaboration across geographies and building trust. I was really very interested to hear that a third of the registrants on this platform are from outside the US, because I believe that it is a tool to bring patients together no matter where they are on the globe. Our needs are not gender specific or culturally or age specific or tumor specific. I think that something along these lines can serve so many needs of patients on a global scale. Just speaking as a patient, platforms like this that can bring patients together, especially in a type of scenario such as a mentoring type of program where you could potentially be connected with someone that has a similar tumor type that's walked the walk before you and can help guide you, especially during COVID when people can feel very alone, very isolated. These type of platforms can allow that to happen. And I'm just very encouraged and very happy to see that these can all be brought to the forefront to help patients like me.
Thank you, Jen. Actually, I think, kind of what you were just talking about, being able to connect with people, like you and maybe get advice and things. I think this is really important right now. A few of the other COVID advocacy exchange sessions that we've had have focused on care. So we've talked about returning to clinical trials, access to care, preventative screenings, all things we know are so important for people impacted by cancer. What are your thoughts? And maybe I'll bring it back to you, Jen, and then we'll ask the others. But what are your thoughts about making sure people continue to take care of themselves during the pandemic, and what advice should we give to them? We've already seen so many studies come through about the lack of screenings, the lack of care that is happening out there because of COVID. What would you say during this pandemic? What advice would you give people?
Kathy, I would say to continue to make your health a priority. I try to express gratitude every day for the fact that I'm able to create more memories with the people that I love. I think even though we're in this world of a global pandemic right now, that should not stop. And if you haven't made it a priority in the past, that this is a great time to make it a priority. I personally have found that my medical team, and then also my professional life, our medical clinics, are doing everything in their power to make us safe as patients, but also them safe as they be healthcare providers. They've also expressed to me that they are very fearful that patients in the near future will present with more advanced forms of cancer, which of course makes for a longer and harder journey for patients. So to be able to utilize those resources at this time, I think is truly vital for everyone. And just not to be afraid to feel very confident that your health is their top priority and to push forward. I can give you an example. My father, who's 77, has pushed forward through COVID with cancer surgery and also radiation. He and I have worked together to make them feel much more confident about it. But, you know, I'm so very proud of him because he could have said, I'm not comfortable doing this. And he is such a vital part of our family. So I'm very grateful. So I would just recommend to folks to just still make it a priority in your life, or to begin to make it a priority, especially for the people that love you.
Yeah. Jen, honestly, thank you. Thank you for that. I agree. Advocating for yourself, or, you know, for your loved ones, or pushing them to go advocate. It is really, and it's so important right now. I've seen even some of the comments here on the link in the chat about mental health. I mean, this is going to be, you know, this is really an issue right now. But I agree, you really need to ask questions or seek the help needed, whether it's mental health or whether it's, you know, physical health. And, you know, the telehealth portals, a lot of folks are texting about this. They're really important right now. And these platforms really can help those in need. So I appreciate that. Dave, let me jump to you as kind of, you know, the CEO of Grit Health, who is now, you know, successfully launched a second year of the Global Virtual Cancer Congress, and now also partnering with us to launch the COVID Advocacy Exchange. You know, what advice do you give to make sure people are taking care of themselves during this time?
Yeah, thank you, Kathy. Something I've heard in everybody's comments, and it really makes my heart smile, was something that our speaker on Thursday in the COVID Advocacy Exchange gave a word to that I had never heard before. Harry, who is at Rutgers University and presented some amazing information on health equity, used the term intersectionality. And his comments were, you know, we talk about cancer here, and then we talk about gay rights here, and gender equality here. And in reality, these are not separate issues. We are humans. And just like the health system is a system, we can't, Kawaldip, you were just saying this beautifully, we can't fix a problem over here and not think it's going to affect something over here. And humanity is the same way. You know, we represent a collection of attributes. And I have felt from Kathy, all of our conversations and everybody coming together, that we're not just solving cancer, we're not just addressing mental health, we're helping people feel humanity and solve system-wide issues. And so my advice is twofold. Be with people that help you feel connected. And whatever form that comes in, people will draw you to being a part of something. That's changed my life. And then the second thing is really be open to hearing things that are different from how you see in your own eyes. And we've heard from people that have given me new understandings, you know, of what it's like to be an African American, or what it's like to be in the gay community. And being open to these things has made me more human. It's the only way I can describe it.
Thank you, Dave. Yeah, I mean, you're right on too with, you know, just making sure that we're coming in. I think, what did John say the other day on that, you know, coming in with our eyes wide open and really looking at that full picture. So I guess, Kawaldip, jumping over to you, something that Dave had said, you know, because you're also working across the globe, you know, what would you say right now about making sure people continue to get care for themselves? Whether it's mental or, you know, the physical, are there some good tips? You know, we're obviously the Global Advocacy Exchange, the COVID Advocacy Exchange, and this conference are very helpful. What else would you say that might help people?
Firstly, I think to share with you, up to before COVID happened, every political leader in the world was saying that health is a sovereign matter. So if any patient advocacy group from outside went and spoke to Zambian president, he will say, pushback. Health is a national matter. It's a sovereign matter. You can't say anything to me. COVID-19, I'm thankful, and it's a bizarre way that it has actually dropped that myth. It has shown to the political leadership that health cannot remain a sovereign matter alone. It's a global matter. So therefore, that gives us a legitimacy. So patients in low and middle income countries who are now struggling can now reach out to us. And it is incumbent upon us who are living in countries which have got resources, and we have got the political networks, and especially the advocacy exchange programs like this. We need to advocate on their behalf. Yes, they are fine advocating upon themselves, but they do need a little bit of help now locally. We're just finishing off designing a program on how to advocate in the new digital age. We just set up a toolkit working with the lecturers, and we're just finishing that off. And one of the important lessons there is that let's not forget the nodal networks. Let's look at the influence patterns around the globe. Who can change things fast, who cannot? And sometimes your answer must be behind you, you know, like if you go into a plane, which you haven't for a long time, and the woman next to you says, what happens if there's some problem? Or the guy on the left says, what if happens a problem? And the air hostess says, well, look behind you, the next, the door escape is there. So let's look at those things, very important. So similar fashion, we are saying that let's keep on working together, look at equity, as Dave has correctly said. Their need is our need. And I think now when we come to the real crunch part of this whole thing, we'll have to vaccinate people. And guess what? It's a golden opportunity to realize that we actually need global herd immunity. You know, having a national herd immunity means nothing now. We need to have at least 60% of the world vaccinated and inoculated, because otherwise you in your little isolated Germany or US or somewhere else, you'll be forever besieged by this. You know, you can't cross, you can't travel, you can't trade, you can't have visits, you can have nothing. So therefore, with that, I think we've got that legitimacy now from COVID, and we should grab that and help everybody. And please look out for what we are doing at IAPO. I've sent you my link to the Asia Pacific Congress. 2 years ago, I would have just said it's reserved for Asia Pacific patients. We're now saying, no, we want you to come and see what's happening in that region.
Yeah.
You're welcome. Your input is absolutely essential to us. And please take back what we say. And we may have good things. Korea, Taiwan have done great things. We may have bad things like in India. But then again, we might have good examples from California, or we may have good examples from Boston. And we can work together on that. So yes, the legitimacy is there now with COVID. We have to work together.
Yeah.
And don't be shy to help out, I think. Previously, we were very shy. We always said, if there's a child standing by the road or a dog standing by the road, we always step forward and help them across. And drivers understand. So I think same way with us now, you step across, help these patients, the politicians will understand. Thank you.
No, you're right. I mean, it's a policy issue, you know, government issue as well, and it's global. Somebody says, you know, up here, Jacqueline, healthcare is a global matter. And this is absolutely 100% the case. We can't continue to work in our little silos, even though they're big countries. We do need to come together to solve. And this COVID has definitely helped. So, you know, with that, certainly, if you haven't already, try to visit us at the COVID Advocacy Exchange, because we are going to be talking about some of those issues in the near future. So recently, we held a session on the exchange featuring a renowned organizational psychologist, Adam Grant, and he spoke about resilience in trying times. And as members of the cancer community, all of you really know about the power of staying positive, right? So what are some of the things each of you do personally or encourage others to do to be resilient when faced with challenge? And maybe Michael, if you don't mind, I'll start with you on that one.
Thanks. I love this question. This question gets to the root of why I have worked in cancer care for 18 years. I think that there is something about facing a daunting disease and a daunting diagnosis that can bring out the most incredible courage and wisdom in somebody. I was brought to cancer at an early age. I lost a very, very good friend of mine when we were just teenagers. And I think about him all the time. And I think that I can't believe what an old soul he was, because I feel like emotionally he was probably even past where I am now, as a middle-aged person. So I've seen it over and over again in our patient stories and our patient experiences, just strength, courage, and an ability to kind of have this emotional intelligence to talk about what real fear looks like, what real despair can feel like. And so I draw upon that. And I think that kind of ubiquitous nature that I talked about of cancer is something that everybody has an opportunity to really hear from and draw strength from. It's funny, when we face something like this, it's almost like the last people emotionally that I worry about are our patients, because I've seen them already go through so much, and just hearing their stories gives me motivation to, okay, if they can do this, then we all need to do this. We need to pull together. And I think Kawaldip touched on something that was pretty important too. One of, I think, a global challenge right now that we are all facing is misinformation, especially as we get vaccines and things, and as the kind of cross currents I mentioned earlier of cultural challenges to this. We need to keep amplifying those stories and realizing that truth getting out there is going to help battle misinformation. It's going to help battle mental health problems, because I think that now we all understand what it feels like to get one of these, a diagnosis like this and a challenge like this in your life. We are one people fighting a common health challenge now, and this really does. I had this wonderful moment of humanity on a call when this started with our global team, and it was amazing. We had Africa, we had Malaysia, we had Thailand, and I think we had India as well, all on the same call. And for the first time I could remember, everybody was going through the exact same experience at the exact same time. We all were stuck at home trying to figure out how our kids were going to learn and how we weren't going to lose our mind through all this. And I think like that wonderful little piece of humanity right there was really the secret is, okay, let's keep talking about this. Let's keep kind of bringing these challenges up and realize that this is something we have to solve as a group and not just in our silos. So.
Yeah. No, I actually, I agree. One of my, I guess kind of going into this is, if we're looking to the future, obviously COVID, we had originally, Dave, when we talked, we had set up the exchange to go from, May to August, because we thought, oh, a couple months, this should be gone. And obviously that has not happened. But I think, Michael, kind of what you're saying, and Kawaldip and Jen, we do need to work together. We're going to need to work together, and the expectation is going to be to do that. So I don't know, maybe Dave, I'll ask you, what do you think that might look like, working together in the future? And it's going to be a lot longer than August, as we know.
Yeah. Michael, I want to applaud you for saying we know what real fear feels like. I think so often we're taught to be polite or to be just positive. And I come from a family where PTSD was a part of it. And so talking about sensitive issues was hard. And I remember I heard a quote that has always stuck with me. And that quote is, our ability to really succeed is commensurate with our willingness to fail, right? We can't hope to do well if we're not willing to try things we're not familiar with. And I think that our ability to be happy is the same thing. If we're not willing to acknowledge when things are really hard or uncomfortable or unequal. And I think this has really shown us how to be open about things that are unequal. And so I applaud everybody that can say the things that are hard, but still need to be said. And Cathy, I think I just got on my soapbox. I don't know if I answered your question properly.
Well, no, because it's a discussion too, but, I think, I'd love to, talk to this group about, what could be some of the valuable discussions in future sessions, or what could we as team members in this whole healthcare system, how can we work together? What would be some areas of future discussion? Because I think, I've been taking a ton of notes here, but we've been building trust, we've been collaborating, innovation really across sectors expected, with equity. But I think Kawaldip said it, and others here, no more isolation. So as we continue the advocacy exchange, because BMS leadership has agreed to continue the advocacy exchange into 2021, to be a resource for advocates, for patients, or for anyone really who might need a little bit of help. Let's start there, I guess, Dave, and maybe, is there something specific that you could see us working on, and for all of you to think about, because I'd like each person to kind of answer what they think there.
Yeah, I love that question. 2020 has created an openness, and the things that have been discussed in the advocacy exchange are really profound and perspective granting. What I've heard from so many of the advocates and the community members is that in 2021, we want to be a part of change. How do we work towards not just defining them anymore, but creating real change? And so we're already brainstorming, how we define an area and then bring together stakeholders to define what change we want to be a part of, and then how we reach it and disseminate that. So I would love everybody's input. Michael Max Foundation has been so involved the whole time, and Kawaldip too. Can I turn it right to you guys and see how, creating tangible outcomes can move these issues forward?
Yes, can I take just go a little step back? Or the question Cathy asked was, how do you build that resilience in this time? And I think one of the golden tips I found was, I read a book called Birding in Borrowed Time. It was a book written by Phoebe Schnitzsinger. And when she was diagnosed with cancer, she decided that she would like to go and look at these birds, every bird in the world here, because birds are fascinating things. They inspired her, they distracted her from her condition. And every time she came out of a trip, she came back focused and very resilient and very to go and get together. And this discussion I had was with Greenwood, who is the chair of Bio, and he's also a director of the Audubon Society, the Budding American Society. And we both had said that, look, this is very important, and it's really, and I emailed him recently, about a month back, and said, Jim, what's going on? You know, how are we going to help our fellow? He says, you know what? I've just got an ideal answer. There are lots of patients who are birders who are now sending me links to bird tables, which have got live camera feeds. And guess what? We have an online patients birding club, which roams around the world 24/7, looking at bird tables from Panama to right down to Taiwan. And that's what we need, that kind of collaboration, that something away from our disease, a collaboration which builds trust. I mean, Jim Greenwood is an amazing leader of the budding community, besides being Biogen's big guy. And I think this is what we need to do. So yeah, now going forward, these are the things we need to build up, I think there. We should now bring another, possibly I would suggest, one of these advocacy group, which looks at the kind of interests that bind us. I'm sure cooking is one. I wouldn't mind seeing that recipes, and these are serious answers. Huh? This is not a joke. I just attended one cooking session somebody's done for patients who have just had colostomy, bowel surgery, and as you know, we always have real difficulties. I can relate to that. And she did a very good program on how to cook back better, how to get things done, and I think everybody loved that. There's one about wearing the colostomy bags. It was a very good session. I mean, it was amazing young girl who really showed. I learned something from that. So we need to look at those, that it's not that the limiting, it's things that unify us, and they also take us away from the conditions, yeah, temporarily, bring us back recharged. So yeah, that's what we're looking at. Thank you.
That I actually really like that idea, and it's funny that you say that, Kawaldip. I mean, it's not funny, just as you said, but you know, I think sometimes we do need to think about other things right now. I mean, one of our you know, the biggest participation we had was when we had Adam Grant speak, and it was about resilience, and it wasn't necessarily about being a patient, but it was just about these, you know, these times that we're in, that we're all in, and how hard we're all working, and how different it all is. And so yeah, I like that idea of looking at some different opportunities and collaborations as well. So we will definitely take that into the account. Jen, I'm wondering how you feel, because I know you've been a part of the exchange, wondering how you feel and what are some of the issues or topics that you might like to see in the future.
Sure, Cathy. I've spoken to quite a few people about this, that when you're given this diagnosis and your life literally changes in an instant, and then you're also thinking about how it will affect not only your family dynamics, but implications with work, with your family, with your children. We have 3 small children, so when I was first diagnosed, how to tell my children was something that my husband and I were trying to grapple with, and realized that we absolutely needed help in terms of counseling, for us to understand how to frame that conversation for our children, and then also how to push forward to the other side, to give them the confidence, and also myself the confidence that mom was going to be okay. I do think, especially in this COVID environment, any assistance in terms of how to convey the news to your loved ones and also to your employer, to understand, you know, how personally and professionally this is going to impact you in your life going forward, and then also knowing that you're probably stronger than you think that you are, but if counseling is not something that you've ever experienced or searched for, that it doesn't make you a weak person by any stretch. These are extraordinary times, I believe, that we are living through. So any assistance to help to smooth, these challenges that have been placed in front of you, I think actually makes you a stronger person. So those are just some topics that I think could potentially be of help to others.
Thank you. No, absolutely, Jen. And again, really appreciate you participating in your feedback, because it has been really helpful. And I think some of those topics are really important as well. And we will definitely take note. Michael, I don't know if you had anything that you wanted to add as far as, any kind of topics or issues that you think would be important on the exchange.
Yeah, I echo wholeheartedly what Jen just said. I'm a big believer in patient groups because of that emotional support that it offers. It does not make you weak, it empowers you. It is absolutely, I've seen the best examples of leadership, some of the best that I've ever seen come out of our patient groups that we've worked with, because I think once you take that opportunity to tell your story and to emotionally support others through what is just so daunting, really empowers you and then allows you to empower others. And it's a wonderful channel for information and fighting the misinformation and isolation that I think everybody's trying to grapple with right now. This COVID just occupies, a huge space in our life right now. So, and it's, I think, keeping cancer at the forefront of the health conversations is important, and it happens through collective group voices like that. And so we've just always been a big believer in those patient groups, and I've seen the good that they do. So, I just think that was a great point to make. Thanks, Jen.
Well, thank you. Thank you, Michael. And well, it looks like we're at the end of our time together. I just want to thank everyone who has joined, the session today. I want to give special thanks to our panelists, Jen, Michael, Kawaldip, Dave. You guys are just fantastic, wonderful partners. There is a chat. We are collecting the information. So to some of the questions I asked about the Advocacy Exchange, we'll be definitely taking note of all of this and of what all of our panelists had said today. So thank you so much. We do hope you can go and join the Advocacy Exchange if you haven't already. Dave put actually the correct link in there, which I did not, but it is www.covidadvocacyexchange, all one word, .com. So thank you again, everybody. We hope to see you there, and take care.